It's The Cause on Dubai Eye 103.8. Helen Farmer with you, and the doctor is in the house. This month is Cervical Cancer Awareness Month. Perfect opportunity to shine some light on the fourth most common cancer amongst women globally. An estimated 604,000 new cases and 342,000 deaths in 2020, according to the World Health Organization. So what do we need to know from screening to treatment, vaccines and more? We're here to answer your questions, so do reach out if there's anything that's concerning you, because joining us now live in the studio is Dr. Neha Gami, specialist obstetrician and gynecologist. She's a Health Plus Family Health Centre. To answer all of those questions, 4001 is the SMS. You've got the ARN Play app, and you can, of course, on WhatsApp us too on 04871 5500 anonymously if you prefer. Dr. Neha, lovely to have you with us, and I think this is such an important, really important topic. Something that I think a lot of people kind of shy away from. It's one of those kind of, I don't want to go for a smear. I find this really uncomfortable to talk about. Never mind, go to see a doctor about. So hopefully we're breaking a bit of stigma and taboo around this, because, as I said, fourth most common cancer in the world. Now, before we get into symptoms and screening, I was wondering if you could explain for us in kind of simple terms, as a gynae, what exactly is the cervix and what's its purpose in the female body?
Thank you for having me, Helen, and thank you
welcome.
for picking up this topic. It's such an important topic. I mean, I cannot emphasize more. To start with, the cervix is basically the neck of the womb. So it's the lowermost part of the womb that opens into the vagina. That's the opening where which opens up to deliver the baby, and that's a very, very important part of the body, of course. And the only problem is that it's a very rapidly changing part. There's a zone there which keeps changing. The cells keep growing. Old ones get shed, new ones get put on, and that's why it's a very common site for cancer to start,
because it's quite dynamic.
It's dynamic, exactly.
So with this kind of cell renewal, that means presumably that we as women need to be pretty well on it when it comes to screenings, because presumably things can change quite quickly.
Exactly, and that is why it is recommended that at least every 3 years women should go for screenings, because things can change.
I think 3 years is quite a long time.
The thing is that it takes time for these changes to happen.
Okay.
So yes, if you go more frequently, you're likely to pick up a lot of things, but our body has the ability to heal them as well. So if you go too often, you might pick up some little changes, which the body may anyways, be able to fix and go back to normal. So you'll just be doing unnecessary treatments if you go too often also. Of course, there are certain women who do need more often screenings if they're immunocompromised, if they have some symptoms, if they've had history of abnormal smears, then we'll do it more often, but not for everyone.
Now, I don't know if you're familiar with this concept, but in the UK we had something called the Jade Goody factor. She was a reality TV star who tragically passed away of cancer, and after that death we saw a huge spike of awareness in especially a younger community of women who thought that cervical cancer was something that happened to their mum's generation, and it feels like that's almost kind of worn off now. That awareness has gone down, and I wondered if that was something that you've noticed, because where I'm from in the UK, I'd be getting a letter through my door every couple of years saying it's time to come in for your smear, Helen, and you couldn't really ignore that letter, whereas here the onus is on us as patients to be coming in for treatment.
Yes, absolutely. So, public health memory is very, very short, and people tend to forget these things. And that's the role that you and I have, to keep reminding them that no, you cannot forget something as important as this, and you have to go for your checkups. So, when you go for your annual checkups, you'll be told when your next one is due, you'll be reminded, and then you just put it in your calendar and go back for it.
I have a friend that does it the week before her birthday, so she never forgets.
That's a very good trick. Link it to an important event in your life, and you'll remember to do it.
So can we talk then, I guess, about at-risk demographics? What age groups, even nationalities of women, are we seeing higher than average rates of cervical cancer?
So the higher rates are usually seen in countries where we don't have access to healthcare, where we don't have pap smears. It's not more than ethnicity of the women, it's more where they are located. So thankfully in the UAE we have amazing access to healthcare, and we can all get our pap smears done. It's all covered with insurance, so we don't have to worry about anything. Just go to your gynecologist and get it done today. But the age group most commonly seen is between 35 and 44, where you actually see the cancer cases. But having said that, cancer changes start in the cervix 10 to 15 years before cancer starts. And that's the window we want to catch. We don't want to catch you when you've had the cancer, right? We want to pick it up when it's very, very early. Simple treatments can reverse it. nip it in the bud and not let it become a cancer. So start at 25 and get it done every 3 years.
Dr. Neha Gami with us this afternoon. She's a specialist obstetrician gynecologist from Health Plus. We're going to talk next about what do you do when you get that notification that you've had those words, abnormal smear, and also the HPV vaccine. Who needs to get it and what do we need to know? That's next.
This content is for
Like just something that you will need a follow-up for once a year.
When you say treatments, I'm sorry, I just want to kind of demystify that.
Yes.
So let's talk low grade. If your doctor's saying, do you know what, it's very early, it's precancerous, we just need to do, what would that be?
So you could be managed with just freezing those cells. So you just freeze those cells, the abnormal cells shed off, and then healthy cells grow from within, and then you're fine. You go back to being normal and just an annual pap smear. And then if it's a higher grade change, then we might have to shave off a little bit, but that's also very few millimeters of the cervix we're talking about, so it won't affect your future health at all. And most women will just go back to being normal within 6 months.
So cervical cancer impacts childbearing if you do have a diagnosis, if that's what it is. It doesn't necessarily affect your fertility, but could it affect your ability to carry and deliver a baby?
So again, it depends at what stage we've picked it up. So if it's still at an early stage, there's something known as a partial removal of the cervix. It's called trachelectomy in scientific terms. And if we do that, then you can still carry a baby to term. We'll help you with a stitch maybe to hold the cervix closed, depending on, what the situation is. But it is still possible. So I wouldn't give up hope. And I would say that, just speak to your doctor and we'll find that. And that's why the screening tests are so important to pick it up at the earliest.
Now, prevention is often better than cure. So let's talk about the HPV vaccine. Can you tell us a little bit about who it's aimed at and the efficacy as well?
Yeah. So the vaccine has really been a game changer for this disease because cervical cancer is primarily caused by an HPV infection, which is a virus, human papilloma virus. Now, if we are able to give the vaccine to kids and girls before they've been sexually active, then that will ensure that when they get exposed to the virus, it doesn't come and take a home inside their cervix. Okay. So that will prevent the cancer in those girls, and it's like more than 84 to 86% efficacy in preventing cervical cancer. Some changes might still come up in your pap smears as you go along, so you still do your pap smears, but it will not let it turn into a cancer. So that's the beauty of it.
So it's available here in the UAE.
Yes.
Now, in other parts of the world, it's really, boys are having it as well. It's opt-in for boys, but we're really talking about young women this afternoon. What age group would you then recommend?
So it's recommended for 11 to 15-year-old girls. It can be given as early as 9 years as well. And in fact, the UAE national program is giving to around 13 to 14-year-olds in school these days. So it's a free vaccine given to girls, just 2 doses, 6 months apart. And, your girls will get it in school. And if you want to take your boys, you can take them to a clinic and get that done as well. Same age, just 2 doses.
And presumably this is something that parents need to be signing off on, not just going to be randomly injecting children at school. So we need to get parental buy-in here. It's a relatively new vaccine. Have you placed any kind of objections or attitudes around it from parents that we could perhaps be addressing today?
The only concern I feel is that a lot of parents feel that our children are not going to be sexually active so soon. So why do we need to give it to them now? It's because their immunity is more susceptible to a response to the vaccine at that age. So it's not linked to when they'll be active, but it's more about protecting them way before that happens, because even one exposure could expose them to the virus. So.
And then for women as we get older, was it worth getting the vaccine when you're in your 30s, 40s, 50s, or is it very much aimed at that younger age group?
So there was an extension of the age group to 26 years of age where it was found that there was some benefit. But after that, especially if you're in a relationship and you already have been exposed, it doesn't really offer you much benefit. No harm, but no benefit as well.
Dr. Neha with us this afternoon. I wanted to come back to cervical cancer. As we said, the 4th most common cancer amongst women globally. Can we talk about treatment of that? And if it is identified at a later stage, what can treatment look like?
So the main treatment is hysterectomy, which is basically removal of the womb. So that is if it's still in early stages, but sometimes it spreads beyond the cervix itself and goes into the vagina or the local pelvic areas. Then it's only radiotherapy, basically where we give radiation to those areas, and that does help. And a lot of women do respond to that even at that late stage.
Can I come back to your point earlier about some lifestyle changes? If you do get that, abnormal smear, kind of notification. If we're talking about, as you say, freezing a few cells, very straightforward kind of, outpatient procedure. What other lifestyle factors could women be doing, trying, adjusting in order to just have a very good health in that part of their body?
So even before that, actually, smoking, like I said, has been a major link to this cancer because it reduces your local immunity as well. Having multiple partners, not using protection, that exposes you to more chances of HPV infection. More than 80% of adults these days have the HPV virus. It's just that, you don't want it to cause cancer. Mm-hmm. So that's why you should protect yourself. Working on your general immunity, having lots of fruits, vegetables, keeping the vaginal health, an optimum. So to looking after that. And I guess that's mainly about it. And of course, immunocompromised conditions, if you have any other medical conditions, then that will predispose you to this.
And lastly, I guess a bit of demystification about the pap smear. For anyone that hasn't had one, and I think a lot of women put it off out of fear because, you hear stories and my goodness, I think things have changed an awful lot since many of us had our first one, a few decades ago, that metal thing that looked like a duck. Can you, and I'm really thinking about any mums listening today who might want to talk to their daughters about what we will need to do when you're a teen and going through into being a young woman.
You're very right. It's changed a lot and it's very, very simple and it's painless now. I mean, if it's a small plastic tube that's put inside you, just take a quick look at the cervix, take a brush from that. We used to have wooden spatulas back in the days. We have now just a very gentle brush. We'll just touch your cervix, get some cells off it, and that's it, and you're done. It's like less than a 30-second procedure. It may be uncomfortable for some, but it's not
no
painful.
one loves it.
Yeah, I know, nobody does.
No one loves it, but it's all part of being a woman.
And it's important.
And it is important. And much like we raise awareness around breast cancer in October, and again, no one loves going in for a mammogram, but my goodness, if you get past the embarrassment and you've got a lovely doctor like you who has, seen it all, talked about it, it's your day to day. There's no embarrassment on your side. It's just get it booked, get it done, take it off the to-do list, know that you've done what you can do and you're controlling what you can control. And then you've got good support should anything else happen. Thank you so much for your time, Neha.
Welcome. Thank you so much, Helen.
Really do appreciate it. One very last question. It's just come in the text line saying, do all schools give the HPV vaccine?
Yes, all schools across Dubai and Abu Dhabi now. In fact, all Northern Emirates are giving the HPV vaccine from 2019. Northern Emirates also. And Abu Dhabi has been giving it from 2013.
There you go. Just need to be getting your buy-in to protect those kids. Thank you so much. Dr. Neha joining us there from Health Plus Family Health Centre. Fantastic to have you with us this afternoon. It's coming up to 3:30. Got a brilliant prize. If you want to get in touch and tell me your Dubai story. How long have you been here? And let me know what brought you here in the first place. We could be sending you to the nation's capital to enjoy some golf. We're heading over now to get your latest headlines on